Welcome to the meeting number 26 of the House of Commons Standing Committee on Government Operations and Estimates. The committee is meeting today from 3:34 to 5:34. We will hear from the Auditor General and her colleagues as part of the committee study on the government's response to COVID-19 pandemic. I would like to take this opportunity to remind all participants at this meeting that screenshots or taking photos of your screen is not permitted. To ensure that an orderly meeting, I would like to outline a few rules to follow. Interpretation in this video conference will work very much like in the regular committee meeting. You have the choice at the bottom of your screen to either floor, English, or French. Before speaking, please wait until I recognize you by name. When you are ready to speak, you can click on your microphone icon to activate your mic. When you are not speaking, your mic should be on mute. To raise a point of order during the meeting, committee members should ensure their microphone is unmuted and say point of order to get the chair's attention. The clerk and the analysts are participating in the meeting virtually today. If you need to speak with them during the meeting, please email them through the committee email address. The clerk can also be reached by his mobile phone. For those people who are participating in the committee room, please note that masks are required unless seated and when physical distancing is not possible. I'll now invite the Auditor General to make her opening statement.
Mr. Chair, thank you for this opportunity to discuss our recent reports on the government's response to the COVID-19 pandemic that were tabled in the House of Commons on March 25th. Joining me today are Joanne Schwartz, Philippe Le Goff, Carol McCullough, and Chantal Richard, the principals who were responsible for the audits. The reports presented were the first of many audits on the government's response to the COVID-19 pandemic that my office will conduct. There is no doubt that the COVID-19 pandemic was an all-hands-on-deck emergency the world over. Governments had to mobilize quickly to respond to the public health, social, and economic effects of this pandemic. Canada was no exception. Nous avons constaté que le gouvernement.
While we found that the government was not as ready as it could have been for a pandemic of this magnitude, the public service mobilized nonetheless, and priority was put on the needs of Canadians and quickly delivered support and services. I'm going to turn first to the Canadian Emergency Response Benefit, the CERB. With this benefit, the government wanted to quickly deliver financial support to eligible individuals. We found that the Department of Finance, Employment and Social Development Canada, and CRA, the Canadian Revenue Agency, rose to the challenge and quickly analyzed, designed, and delivered the Canadian Emergency Response Benefit. To simplify the process and get support to people quickly, ESDC Canada and the Canadian Revenue Agency took the approach of relying on personal attestations and automated prepayment controls to validate these applicants' eligibility. Once the benefit was launched, the agency and the department introduced additional prepayment controls in order to limit potential abuse.
On personal attestations, post-payment verification becomes very important. Employment and Social Development Canada and the Canada Revenue Agency are working to start their post-payment verification efforts relating to the Canada Emergency Benefit later this year. Their work in this area will be the subject of a future audit. Turning now to the Canada Emergency Wage Subsidy. We observed a similar focus on getting help out quickly, in this case, to businesses. Once again, the Department of Finance Canada and the Canada Revenue Agency worked together within short timeframes to support the development and implementation of the Canada Emergency Wage Subsidy. The design and rollout of the subsidy highlighted pre-existing weaknesses in the agency's systems, approaches, and data. These weaknesses will need to be addressed to improve the robustness of Canada's tax system. Afin d'accorder la priorité au versement de la subvention,
In order to prioritize the payments, Canada Revenue Agency chose to forego certain controls that it could have used to validate the reasonableness of subsidy applications. For example, the agency decided that it would not ask for social insurance numbers of its employees, though this information could have helped prevent doubling up or double dipping of applications for financial support. This decision limited the agency's ability to perform prepayment validation, as did the absence of complete and up-to-date tax information that would have helped to efficiently assess these applications. I'm going to turn next to our last audit, which focused on pandemic preparedness, surveillance, and border control measures. In this last audit, we found that the Public Health Agency of Canada also was not as well prepared as it could have been to respond to the COVID-19 pandemic. Not all emergency and response plans were up to date or tested, and data sharing agreements with the provinces and territories were not finalized.
Relied on a risk assessment tool that was untested and not designed to consider pandemic risk. The agency continued to assess the risk as low despite growing numbers of COVID-19 cases in Canada and worldwide. In addition, the Global Public Health Intelligence Network did not issue an alert about the virus that would become known as causing COVID-19. I am discouraged that the Public Health Agency of Canada did not address long-standing issues, some of which were raised repeatedly for more than 2 decades. These issues negatively affected the sharing of surveillance data between the agency and the provinces and territories during the pandemic. While the agency took steps to address some of these problems during the pandemic, it has much more work to do on its data sharing agreements and its information technology infrastructure to better support national disease surveillance in the future. We also found that the Public Health Agency of Canada and the Canada Border Services Agency implemented restrictions at the border and quarantine measures. They provided guidance and tools to inform travelers and essential workers coming into the country of public health requirements. Toutefois, l'Agence de la santé publique du Canada n'avait pas.
However, Public Health Agency of Canada had not contemplated or planned for a quarantine on a nationwide scale. From the collection of travelers' information through to all enforcement activities, including the follow-up on identified individuals who might be at risk of non-compliance. As a result, the agency does not know if the majority of travelers were properly quarantined. These audits looked at programs that were rolled out in record time. Faced with a full-blown pandemic, the public service focused on the pressing outcomes, immediately helping Canadians.
The pandemic has shown that when the public service must, the public service can. This crisis has highlighted the importance of dealing with known issues, whether it's agreeing on which organization has the lead, who will do what when, who will report what to whom, or replacing outdated systems or processes and addressing issues in data quality. These are not problems that you want to have to deal with at the same time that you are focusing on helping people, because this is not an efficient way of working, nor is it a productive way to serve Canadians. Government organizations need to do collaboration better. We made recommendations to each audited organization, and they agreed with all of them. Mr. Chair, this concludes my opening statement. We would be pleased to answer any questions the committee may have. Thank you.
Thank you, Ms. Hogan, and appreciate your comments. We will now start into some questions, and we'll start with 6 minutes with Mr. Paul Hughes.
Merci, Monsieur le Président. Bonjour, Madame Hogan.
Thank you very much. Welcome, Ms. Hogan. Now, the first, the Department of Health, we often hear that the measures of quarantining at the borders are the most strict in the world. Now, PHAC had not planned a national quarantine system and what to do for non-compliant individuals. You've also mentioned that the agency doesn't have a clue as to whether or not people did comply. If so, how many? So the Minister of Health is actually bragging about things that were not implemented. Now, that's a bit of politicking in another system which seemed to have worked fairly well. May I respond, Mr. Chair? Well, the comments of the minister occurred after the completion of our reports. So we completed these before early January to the end of June. So it was the initial period of this pandemic where there were many, many Canadians who were repatriating to Canada because they were aware that the borders would be closed. So we focused on that period of time, and I really can't advise you any further on the issue. No, but I can confirm that during that period, Minister Blair or others said we had the best control measures in the world. Now, I understand that you did do this study in the early part of last year. But the minister also mentioned, and here I don't know what the time frame is, that she had hired 1,000 extra individuals to help out at PHAC. But the systems are out of date, the data was not reliable, and the system itself was a bit wobbly. So these 1,000 individuals, how did they work? I mean, were they doing manual sorting? People were coming into the airports. Perhaps it was on paper, hard copy. Do you have any idea of how they completed their work? Well, I'm not sure where these 1,000 individuals were deployed by PHAC and exactly what their functions were. But we did note during our study that, yes, initially at the beginning of the pandemic, there were some trouble spots in the systems. First, at the border, the travelers' data was in fact being transmitted with paper-based forms. This caused some delay in their capacity to follow up with these travelers. Another example, we saw manually handled data, was the exchange of information between and among the FPTs, the federal government and provinces and territories. It was provided in a numeric form, perhaps, but they were terribly mismatched, different formats, formulas, etc. And this didn't conform to the systems that were in place by employees of the agency. Well, my next question then, the coordination between federal authorities and provincial ones. You state that they only had about 40% uptake of those individuals who posed a potential risk. Now, of the million or so individuals who were perhaps ordered to do or should have done 14 days of quarantine, we see that you've noticed spot checks in your report. 46% of these didn't respect or conform with the quarantine regulations. And provinces such as Quebec, we've learned quite recently, hadn't even been informed of these. Nobody was saying to Quebec, here is the list of people that you should be following up on and who are probably on Quebecois territory. So the Premier of Quebec stated that they weren't even aware of it. Was that in fact the situation? There was no coordination at that time? Perhaps where some provinces have RCMP police forces, but not in Quebec. Well, we noted that with the follow-up of travelers at the border, it's quite true that Public Health Agency of Canada was unable to indicate that 2/3 of travelers, they were unable to provide data that they did or did not conform. So these have been in place since the 25th of March. Before that, it was sort of a voluntary-based quarantine, but after that, date mandatory. Of all travelers coming in, they were based on a risk-based analysis. Those who were high risk, they should be following the quarantine, but if they didn't, they should have been referred to the forces of law and order, if you will. But half of these were in fact reported to the police forces, and they had not complied with. They couldn't provide the police forces any kind of proof that they did conform to the restrictions. So that's half that for which we have no proof. Now, if the quarantine it was not terrifically effective. So you provided information, this was provided, but then there was no further follow-up. It fell sort of in an empty space. Thank you very much.
We'll now go to Mr. Johari for 6 minutes.
Thank you, Mr. Chair, and thank you to Madam Hogan and your colleagues, first of all, for the testimony today, as well as the great work that you're doing. Madam Hogan, you opened up your comments or your testimony by saying that in general, Canada didn't seem to be ready, or PAC didn't seem to be ready for the pandemic. Have you had an opportunity to look at other jurisdictions, G7 or G20, to see how their performance as far as the readiness and whatever you put under the readiness column, whether it's a surveillance, whether it's a support mechanism for the economy, for individuals, for businesses, as well as health and safety. How do we compare against those?
Thank you very much for the question about pandemic preparedness. I guess what I would start off with is maybe to just give you a little bit of summary of very quickly the 4 areas where we felt that the Public Health Agency of Canada was not as prepared as it could have been to respond to a pandemic. So the first would have been that emergency and health plans were outdated, and more importantly, that the federal and provincial and territorial plan had not yet been tested. The second thing that we noticed was that there was a long-standing agreement between the provinces and territories and the federal government about sharing of health data surveillance. So that agreement had not yet been finalized, and in fact, the infrastructure needed to handle the volume of all of that had not been updated. The third thing we noticed was that the agency was using a risk assessment tool that was not designed to be used to consider pandemic risk. And then finally, as we just mentioned, the agency had not planned nor contemplated to enforce a mandatory quarantine across the nation.
Yeah, I thank you. Those are the areas for opportunity for us to, enhance. And I saw that in your recommendations, specifically 8.51, 55, and 65 and 66. But the question fundamentally was that, was there any other country that was ready for this pandemic, and when it came in, they were 100% there, and all their policies was there. I'm trying to figure out how did we fare. And just quickly, because I really want to go into the three areas of recommendation that you've made. Thank you.
All right, absolutely. My apologies. I'll try and go quicker. Normally we would compare ourselves to other countries. As you can imagine, in the middle of the pandemic, it was really a difficult thing to do. But what we did look for was whether or not Canada was following some of the best practices according to the World Health Organization, and some of our findings were that they weren't, right? So I don't think any country was prepared for this type of a pandemic.
Okay.
I do think that everyone could say that.
That's fair. Thank you very much. On your recommendation 8.51, which you're specifically talking about that the Public Health Agency of Canada should, in collaboration with its provincial and territorial, finalize the annexes to the multilateral agreement to help ensure that it receives timely, complete, and accurate surveillance information from its partner. Can you specifically highlight some of the key areas that, in your opinion, or in your department opinion, it was missing? And what was its impact on our government response during the first wave and subsequent second and third wave? Now, I understand that this report only focused as a result of the first wave, but based on your observation, what was the impact of those key areas that was missing? And if you could highlight those, that would be great.
So absolutely, when it comes to sharing of health data, and I might turn to Chantal Richard in case I missed something. But what was needed in those annexes was really getting a common understanding of the types of elements that would be shared and how and what format they would be shared in. As you can imagine, every disease might have different peculiarities, but basic things like the timeline in which to report. In this case, it was decided that with every 24 hours, reporting was needed. But agreeing on that, because we noted that provinces and territories likely were having a difficulty meeting that because very few of the reports came in within that time frame. We also found that only 10% of the files from the provinces and territories contained important information like symptoms. And in an evolving disease, symptoms are really needed in order to inform the response to the country and whether or not it needs to be adjusted. So it's having that basic understanding of who's got what role and responsibility and what information should be transmitted, how it should be transmitted in a timely way. So what happened here is we saw that the Public Health Agency with the provinces and territories adjusted throughout the pandemic to what they were capable of doing. The end result was that it delayed the federal government's ability to assess and better inform the response to the pandemic. It's not that they weren't able to eventually gather all the data. It's just there was a lot of delays in putting it all together and seeing a global picture.
So what you're suggesting is had we had these in anticipation and the proper referendum, government of Canada would have been able to respond better for as far as being supporting the provinces. Is that what I'm hearing?
Well, I don't think anyone would be able to say what would have happened if we had been better prepared. But obviously, if you've ironed some of this out, you're not doing it sort of on the fly in the middle of responding to a pandemic as well.
Okay, I got about 10 seconds left. You talked about the long-term pan-Canadian health data strategy. Can you spend about 10 seconds on it and saying what do you mean by that strategy?
No, just because it's quick, maybe I'll ask Chantal Richard to jump in and give you some of those extra details.
Ms. Richard, if you can do it very quickly, please.
Yes, I would just say that that pan-Canadian data strategy is meant to incorporate both the information sharing pieces, but also the IT infrastructure and having those systems speak to one another so that the information is shared more readily as well. So it's the strategy would cover both of those elements.
Thank you,
Mr. Chair.
Thank you. We'll now go to Ms. Vignola for 6 minutes.
Thank you very much, Chair. And thank you very much, Ms. Hogan and your team. You're new before us, and every time we read your reports, in order to know a little bit better how we can improve the various systems that compose our democratic process. I read in your report that as of the 11th of May, there were certain automated control by CRA to integrate some of these data with the insurance employment, for example, and the agency told you it wasn't possible to do so because it would have slowed down the disbursement of some of these benefits. Did they tell you what kind of lag this created? How far did it slow down the process? Are you talking about the CERB or the wage subsidy? The CERB. Okay, thank you. Well, perhaps one of my colleagues can answer this, but for the CERB, the government was seeking the social insurance number, and these were not necessarily matched initially to match which individual. It took about a week after the launch of this particular benefit that this control, this specific control, was put into place. Prior to that, about $500 million had been dispersed in that week, so perhaps there was some overlap or double payments. So this is why the tax returns after payments of these is going to be so important. So perhaps one of my colleagues has something to add. Apparently not. Okay. Well, yes, but the agency, the CRA, was saying the 2020 tax returns will be able to track some overpayments or witch payments. Will this be the same in order to detect that there might have been some fraudulent application? In other words, maybe identity theft was used to obtain benefits illicitly. Well, in our discussions with the agency, this process apparently is the same. The post-payment analysis and follow-up will, in fact, be able to determine if there were fraudulent, non-eligible requests for payment. It will also identify payments that may have been granted because someone was, with fraudulent intention. All of this will come out in the wash with the audits that Revenue Canada will be conducting after this current tax system period. Also, businesses that were receiving benefits for the employee benefit, they didn't have to give the SIN numbers of their employees. They didn't have to prove which employees, etc. So perhaps some employers also benefited, or businesses benefited from these payments when they should not have. There is a possibility that, yes, the wage subsidy would be linked to an individual who was also receiving the CERB. Once the two programs have been launched, it could be that an individual could continue to work, and draw, if they were getting a salary under a certain threshold on a weekly basis, would still be eligible for the wage subsidy. Business and organization could request a subsidy request linked to the payroll, the salaries, to match up on some of these wages paid to individuals. So the individual might have been involved in receiving benefits of both types. One goes to the organization, the other goes to the individual. So there is some distinction to be drawn there, whether it was the hiring or the employer organization or the individual that received it. 15th of April, 2021, we were told that the EI system is about 50 years old, so that's old. That's old. And because of the obsolete character of this system, the quantity of potentially fraudulent abuse, perhaps, of these benefits. We heard a lot of complaints from young people, students in particular, that were subject to identity theft. Well, the system used by EDSC for EI systems is, in fact, obsolete. And it is for that reason that the department was unable to ably handle the quantity of requests made under those terms of those benefits. But we can't blame necessarily an EI obsolete system that we can justify or not discover identity theft. There are other controls within government systems as a whole for determining eligibility or access. So perhaps there's a lack of access to certain databases that were not put in place to check for this sort of access.
Merci.
Ms. Vignola, I will now go to Mr. Green for 6 minutes.
It appears that the floor audio is muted. However, I think it's my turn, so I will begin. And I'll welcome Ms. Hogan, who I've had the privilege of working with quite closely on public accounts. I'm one of the few MPs who has the privilege of going back and forth between those two accounts, between those two committees. And I want to open up my line of questioning in a way that is respectful. This is certainly not going to be any kind of gotcha, but I need to address some inconsistencies that I have experienced from the reporting and the testimony at public accounts and the reporting and the testimony that we're having here. And I'm going to try to do it in a way that is clear, that will allow you and your staff, through you, Mr. Chair, to think about how this might be, perceived in the public. And I think about like the critical questions in any audit or in any reflection on work that is this serious, which is, what did you know? When did you know it? And then what did you do about it? And you'll recall on April 13th, in a line of questioning that I had to Ms. McCalla, we were talking about the ways in which modeling, both provincially and federally, and our surveillance systems, quite frankly, failed to identify through PHAC that there was an issue for the pandemic. And I asked about, was there not international modeling based on experiences in places like China that would have predicted the outcome? And Ms. Hogan, through you, Mr. Chair, put the question to Mrs. McCalla, who stated that the risk assessment is called for in PHAC's pandemic plan, that the WHO did issue a pandemic risk and called attention to the global community of the risk of COVID-19. But we found that at that time, PHAC did not update its risk assessments and only did so in mid-March at the direction of the chief public health officer. And I responded. So then there was an alert. We were alerted to this in advance. And Ms. McCalla responded, there was an alert by the WHO, yes. To which I responded, my God. I would like to ask through you, Mr. Chair, to Ms. McCalla, when did that initial World Health Organization alert come to PHAC?
Thank you for the question. In that response, I was referring to the Public Health Emergency of International Concern, which was issued which was issued by the WHO, and that was issued on the 30th of January, 2020. And in doing so, it recognized that the risk assessment was very high for China and high at the global level.
And then it took us all of February and into March to move on it. Through you, Mr. Chair, to Ms. Hogan, in doing your analysis when you came before us, both at the original committee and today, you stated that the agency relied on a risk assessment tool that was not tested, and that the agency continues to assess this risk as low despite the growing numbers of COVID cases in Canada and worldwide. And you stated that in addition, the Global Public Health Intelligence Network did not issue an alert about the virus that would become known as causing COVID-19. Can you help me understand the timelines from January 30th, when the WHO says this is a significant problem, lets us know how that alert would have differed or been relegated to our systems that weren't tested, and to this understanding that there was no Global Public Health Intelligence Network alert? How does that Global Public Health Intelligence alert differ from the WHO's alert in its seriousness?
All right, I'm going to probably back you up a little bit in time, but I just want to make sure that we understand what happened on January 30th. So we actually have an exhibit in our report, Exhibit 8.1, that outlines a whole bunch of steps, which I think is a really good place for you to see a bit of the timeline, because there's a lot of moving parts. So at the end of December of 2019, the Global Public Health Intelligence Network issued a daily report. If you might recall, and only because the member sits on another committee, the Global Public Health Intelligence Network issues two reports, an alert and a daily report. So there was a daily report at the end of 2019, which contained a link to an article about a virus that would then become known as the virus causing COVID-19. That daily report alerted the Chief Public Health Officer of Canada that she needed to reach out to her provincial counterparts and tell them that there was something serious going on. She did it based on that daily report, but also based on her knowledge that she has of what was going on around the world. In January 15th, the federal, provincial, territorial public health response plan was sort of kicked in, which caused special committees to get together and to start to talk about the response domestically across the country. On January 30th, which is what Ms. McCullough was referring to, was when the World Health Organization declared this a public health emergency of international concern. So that's when they really said, everyone needs to pay attention internationally. This is a really big deal, which at that point, in January, there started to be risk assessments done by the Public Health Agency. All of those risk assessments from mid-January, when the response plan was kicked in, all the way till March, had the risk of COVID-19 to Canada as low. Until the Chief Public Health Officer stepped in and said, based on what she's seeing going along around the world and her discussions with her counterparts, this really should be much higher. And that's where we say the risk assessment tool was not designed to consider pandemic risk. Now, throughout all of this, the Global Public Health Intelligence Network never issued an alert, which is the second type of report it could issue. And an alert signals domestically and internationally that there's something for you to stop and pay attention of on a health matter across the world.
Thank you.
I see a difference between the daily report and the alert.
Thank you, Ms. Hogan. We'll now go to the second round, and we'll go with Mr. McCauley for 5 minutes.
Chair and Ms. Hogan, welcome back. You noted in your opening remarks the government introduced added controls to limit potential abuse for CERB. What were these added controls? And were they strong enough? And in your role as the Auditor General, would you have added different controls?
So your question is about the Canada Emergency Response Benefit. And so prior to the issuance of payments, there were some basic controls in place that would look at
but specifically, you noted in your opening statement, the government introduced added controls. So the question is what were those added controls? And do you view that they were sufficient?
So the first added control was the one that prevented the double application between CERB that was managed from the Canada Revenue Agency and CERB that was managed through the Employment and Social Development Canada. There was other controls that were added to make sure that the student benefits, if you received a student benefit, you were also not receiving the Canada Emergency Response Benefit. But that was I guess the overall big ones.
So they weren't significant. Yeah, they weren't significant. It was still it was still based on attestation, though.
Absolutely, it was a policy decision made here that they would favor post-audit or post-payment verification.
And I understand that. The question, though, is introducing controls at the beginning or perhaps after a month or two, like not basing on self-attestation, but after a month or two, would that not be more efficient to do that sooner rather than wait for after the fact launching audits of the benefits paid out? I recognize at the very beginning we had to do stuff immediately, but it has been an entire year now. Should we have not have perhaps taken away from a self-attestation faster or linked it to social insurance numbers or other more verifiable things faster?
I guess when it came to the Canada Emergency Response Benefit, it was intended to be rather short time frame. It was extended a few times, but that program is done now. Really, if you're looking at the wage subsidy, I would argue, and we found in our report that there were some instances where controls could have been introduced, but a decision was made that focus would be put on post-payment.
Let me ask you, you use the word could a lot. We could have done better preventing or dealing with the pandemic. We could have done this. Would the better word not be should? From your point of view, we should have introduced this. We should have done this. Government should have done this as opposed to could. could is very open to interpretation, I guess.
I guess many of my statements are encouraging the federal government to collaborate better amongst departments and to collaborate better with provincial, territorial, and municipal governments, because we should do better the next time a pandemic or a health crisis happens.
Yeah. Have you looked at what the cost would be of potential abuse or I don't want to say the word undeserved, but perhaps ineligible receiving of benefits because we're doing things after the fact? You've commented in your report about a very large amount of money being sent for wage subsidy to companies that are deep in arrears for owing GST and other issues that could, that they are going to be bankrupt, therefore they're not going to pay back. What do you think is the total exposure for the Canadian taxpayer for the fact that we are doing things so far after the fact instead of perhaps adjusting as we go?
We have not looked at the cost or potential cost to this. That is why in both of our audits on the Canada Emergency Response Benefit and the Canada Emergency Wage Subsidy, we indicated that we will be doing another audit. So our next audit will look at those post-payment controls, whether or not they're designed properly, effective, and at that opportunity, we'll have a chance to look at some of the potential costs that might be might impact the government.
When you were in 6.27 of your report, on page 6, it says the department considered social, economic, health, and safety info to design the program, referring to CERB. Now, I'm wondering how you came up with that. Like, the department considered social, economic, health, and safety. Because one of the items that came out of the CERB was 2/3 of $1 billion being paid to 15 and 16-year-olds living at home. So I'm trying to figure like what social and economic design went into a program to pay 15 and 16-year-olds 2/3 of $1 billion, when perhaps that money could have been used for long-term care centers, procuring more vaccines, or probably other areas needing resources.
Might see if Joanne Schwartz, who is the principal on the audit, would like to add something. But here, really, the eligibility criteria in order to earn CERB was that you had to have had income of at least $5,000.
No, I recognize that, but your report said the department, you made a statement, the department considered social economic info to design the program. So what made you come up with that determination that they considered these issues?
Maybe I will turn to Joanne then and have her answer that more detailed question.
I guess we're out of time. Maybe you could provide it in writing.
Ms. Schwartz, if you could provide an answer to the committee, that would be greatly appreciated. Thank you. We'll go now to Mr. Kazmierczak, 5 minutes.
Thank you very much, Mr. Chair, and thank you very much, Ms. Hogan, for your excellent work and your excellent response today. I think all of us are committed to strengthening our responses, always looking to do better, and always looking to support Canadians better during these challenging times. The central goal of the CERB was to get funding into the hands of Canadians as quickly as possible, to help them through COVID and to allow them to be able to isolate at home and hence protect their health, protect the health of their families, and also to reduce the stress on the healthcare system. About 8 million Canadians had received the CERB, and most people received their payment within 3 to 5 days of applying. Was the federal government successful in its intended goal and that central goal of getting funding into the hands of Canadians as quickly as possible?
What we found in the audit on the Canada Emergency Response Benefit was exactly that the government prioritized the speed of getting payments to individuals in order for them to either stay home or to help replace income they may have lost because of the pandemic. It was also meant to address individuals who may not normally have been eligible for EI, but their hours or their jobs may have been cut or their hours may have been reduced. And hence it was helped to keep them in a stable economic situation. So what we found in the audit was that the program was rolled out rather quickly. It now will be up to the post-payment work to see whether or not all of the individuals that receive the funds were eligible to do so. But if it's about did the government do it quickly, then yes, what we saw was that it was designed and launched in record time compared to other policies when they're newly rolled out and implemented.
Mm. And the CERB was, as we heard today, was administered by two organizations, by ESDC and the Canada Revenue Agency. We also heard today that, of course, the IT system underpinning EI is 50 years old. It's extremely difficult to operate and introduce changes. The fact that 8 million applications were able to be processed so quickly, what does that tell you about the strategy or the system that was deployed to sort of utilize this bifurcated system where you had the CRA and ESDC delivering CERB to Canadians? Was that the right decision?
I guess I would quote quote myself. I don't know if you call that quoting yourself, but I repeat a statement I made in my opening statement that it demonstrates that when the public service must, the public service can. And so here there was really a focus on providing service to Canadians, and Employment and Social Development Canada recognized that its IT system wasn't going to be able to handle the volume of applications that was coming in, and they reached out to the Canada Revenue Agency for support, and together they were able to meet the needs. So I think it just shows that when we have that service mindset, um, and we don't tend to focus too much on process, something important can be achieved, and I think that's what we saw throughout the pandemic in many departments across the federal public service.
Would you agree that it demonstrated just how quickly the public service can respond and how flexible it could be, and creative as well too in those solutions?
Absolutely. I think I would say it wasn't always perfect, but it definitely was the best that everyone could do in the situation we were in.
Okay. We know that about 5 million Canadians utilized the wage subsidy during this time, and one of the stated goals was to keep Canadian workers connected to the workforce during the pandemic. The Canada's recovered about 75% of jobs lost during the peak of the pandemic, and the economy has rebounded better than many of our peer countries. This is what economists are saying. And in fact, the Conference Board of Canada is forecasting 5.8% growth in 2021. How important was the wage subsidy in keeping workers connected to the workforce to Canada's recovery?
In our audit on the wage subsidy, we looked at the design and the rollout of the program and really didn't look at whether or not it was meeting those end of pandemic type goals. Perhaps that's something we can consider to loop into our next audit, but we were really looking at whether or not it was designed in a way to help encourage to maintain that employer-employee relationship, and also to help businesses meet be prepared to, when the economy reopens and move forward. So, I mean, what we saw was that, some businesses, I think everyone across the world can say we saw that some businesses fared rather well during the pandemic, some not so well, and some failed. And so,
Thank you.
that analysis will have to be done later on by another organization or perhaps by us.
Thank you, Ms. Hogan.
Thank you.
We'll now go to Ms. Vignola for 2.5 minutes.
Madame Hogan, au niveau de la
Ms. Hogan, I was reading that the agency didn't always have the most up-to-date data to evaluate the salaries of the requirant, the applicant. 1,700,000 requests. Most were verified. That was 0.4% were refused. Most were verified manually, and the great majority were accepted. So, if all these had been validated manually, would the percentage be the same or would it be significantly higher? I might like to add, perhaps, Mr. Legault to see if he'd like to add anything to my answer. But initially, when we examined the sample, of course, because there is a chart in our report on that, not all the various benefits that were refused were, well, basically, yes, lack of data was one reason, but many of them were just plainly suspicious. It wasn't necessarily because of the request. There was a lot of missing data in order to verify actual salary levels. We would have needed, or the department that is, would have needed some of these check stubs or some kind of proof. Now, they didn't ask for all of this information because basically they asked for these slips once a year. A lot of the information, the fiscal information, often is quite late in any case. So I don't know, Mr. Lacoste, if you'd like to add anything to that, to the answer, to perhaps enlighten us further. Yes, thank you very much, Mr. Chair. It's quite clear that the audit that will occur will give us more information and a much clearer picture at the status and the number of non-eligible people who requested the benefit. We'll get the information up to date shortly. I have to interrupt, but there goes the timer.
2.5 minutes.
Thank you. Going back to the notion of preparedness, I'm wondering in your audits, what consideration you gave to the handling of the National Emergency Strategic Stockpile, and when can we expect the completed audit to come back to this committee on that issue?
During our audit on the procuring personal protective equipment and medical devices, we look at the management of the National and Emergency Strategic Stockpile. Right now, our expectation is to table that report in the House of Commons with another report about support to Indigenous communities, which includes personal protective equipment and other medical staff for Indigenous communities, both at some point near the end of May.
And so in that, though, assuming that'll be the completed version of it, what consideration did you give in these audits, or did you leave it separate from? Like in auditing the government's preparedness, what consideration analysis did you give the failure of the National Emergency Strategic Stockpile?
Given the scope of the pandemic preparedness and border control audit, we decided to scope out the national emergency stockpile and really cover it in our personal protective and medical device report that'll be coming out in May. So we
Okay.
did not consider it in this one.
Okay, thank you.
Mr. Green, you still have another minute?
That's all good. I've had the pleasure of being in front of Ms. Hogan, who's doing a great job, by the way. I'll take my minute to just say that for the amount of times that I've seen her up in front of committees having to work through this pandemic has been exemplary, and her staff always come with really candid information. And I'll just state that I think that the bulk of this, in my closing comment, the bulk of this report is pretty concise in the way that it outlines the government's lack of preparedness in very obvious ways. And so hopefully we've learned these lessons, and hopefully we don't see a fourth and a fifth wave.
Thank you, Mr. Green. We'll now go to Ms. Harder for 5 minutes.
Thank you. I guess my first question, just to lead out here, is I believe you stated earlier, Ms. Hogan, that you said, and I quote, the risk assessment tool was not designed to consider pandemic risk. And in your report, you outlined the fact that there were daily reports that were granted, but there wasn't a risk assessment that was given. So the risk assessment tool was not designed to consider pandemic risk. That's correct?
So that's correct. I just want to clarify that the daily reports came out of the Global Public Health Information Intelligence Network, and the risk assessments are something separate. So the risk assessments did not consider a forward-looking information, so they weren't designed to consider a pandemic. They were really designed to consider once the virus is here, how might it spread within Canada, but not whether or not the virus might come to Canada, and then what might it do? How might it spread across the country? So it's that
Okay.
forward-looking nature that was missing.
So is there something designed to assess the risk coming to Canada?
Yes, I believe the World Health Organization actually has a recommended tool to use for sort of pandemic preparedness and pandemic type forecasting. And it's that tool that wasn't used. The one that was used by the agency was at a point in time, not with a forward-looking assessment. So it does
Okay.
exist.
When it comes to the pandemic when it comes to the virus being in Canada and how we respond to it, you acknowledge in your report that since 2009, the H1N1 pandemic, the Public Health Agency of Canada further developed plans to guide a response to the pandemic. In your estimation, were those plans followed? Was our pandemic plan followed?
As I mentioned earlier in responding to another question, I believe on January 15th, the federal, provincial, territorial response plan was sort of kicked in, I guess, which informed the response. Now that plan had not ever been tested. And a testing of a plan is really important in order to identify gaps and weaknesses, to overcome obstacles. And we might consider it a bit of a tabletop thing that no one really thinks is important to do, but it really is important in order to help you be better prepared.
Okay,
So it was that plan that
inadequate
guided
work
the
was
response.
done. Inadequate work was done then. I mean, you outlined in your report that it was something that had been shelved, that it needed to be regularly be updated, that all of the plans that were put in place needed to be tested, that they needed to be looked at frequently, and that wasn't done. You go on to say that there were daily reports that were issued, but that no alert was given. You talk about how although the agency prepared rapid risk assessments, these did not consider the pandemic risk of this emerging infectious disease or its potential impact, which is information necessary to guide decision makers on the public health measures needed to control the spread of the virus. Why weren't these things done? I mean, they're a part of the plan. They're a part of the things that were discussed in 2019 in our response to H1N1. Why didn't it happen here? Whose orders were those that this information was neglected?
So all the items that you outline are actually all things that should be used to guide the department's, the agency's response and the country's response to the pandemic. A risk assessment tool and the Global Public Intelligence Network issuing daily reports and the alerts are just signals and help guide what the response should look like. I think every pandemic might have a different response. But what we highlighted in our audit was that there were so many known weaknesses that these things had not yet been tested or either updated or agreed to. So agreements between provinces and territories had not been addressed when the agency knew for many years.
I understand. My question is very direct. Who gave the order to say that we wouldn't follow protocols that were developed in 2009?
So
why was the playbook shelved?
The federal, provincial, territorial response plan was used to guide the response. It's that it had not yet been tested.
So we followed it. We followed the guidebook. This is the guidebook.
Well, we only stopped looking as of June 20th. But as I said earlier, I don't believe any country was well prepared for
so
a
from
pandemic
January to June 20th, the guidebook was followed.
To some degree, yes, there were areas.
No. Not to some degree. No, I'm asking you a very direct question, and your responsibility as Auditor General is actually to answer my question, not protect the government. Let's be very clear here.
So I am being very clear that
followed or was it not followed?
On January 15th, the federal, provincial, territorial response plan was activated, and it guided the response that the government took. There were weaknesses in that response because there had not been agreements between the provinces and territories and the federal government on how they might share information and how that information would be used, and hence the response could have been faster. And that's what we noted in the audit.
Thank
yes,
you,
the
Ms.
plan
Harden
was used.
and Ms. Hogan. We'll now go to Mr. McKinnon for 5 minutes.
Merci, Monsieur le Président.
Thank you, Chair. I'd like to, first of all, begin my turn here just to underline what's just occurred. Now, there's a lack of courtesy here on the part of the member from Lethbridge. I think that perhaps she'd like to think about the treatment that she put to the Auditor General. She was accused of covering for the government, and I find that unfortunate. However, Madam Auditor General, thank you very much. I'm glad to see you here today, and thank you in particular for your work. We're living through an unprecedented period where governments throughout the world are having to deal with this. Could be a matter of déjà vu, but it's been a heck of a long time since we've seen such a combination of factors and circumstances with such pressure on supply chains globally, the challenge to all of our health systems. And I think we have to, and your work serves us well in that light, discovered where the weaknesses have been, where the shortcomings are, and how to improve them, where we should be investing for the long term to improve the structures and systems. We can obviously draw lessons from PPI, of course, a very good example of a shortfall. You've emphasized that this is, in fact, a ongoing project, carrying on till May, June of this year. And of course, you can't divulge what you're doing currently, I'm sure. We have to wait for the results. In comparing the government of Canada's efforts and what we are currently trying to do for the supply of vaccines, for example, how do you go about evaluating this situation? Value for money. Are we getting value for money? What are the criteria? What are the mileposts that allow you to judge whether or not, in a general sense, of course, that things are going well or not? Well, I want to make sure I understood. Are you thinking only of delivery of merchandise or in general? Well, in the context of a pandemic, as you yourself have underlined, and the development of these salary supports, economic supports, the government did in fact act very quickly, and perhaps was a little bit less vigilant as to the controls, if you were. But yes, so the supply of goods as well. In both audits on the benefits and wage supports, the government followed best practices, internationally speaking, as they are applied in an emergency. Now, they decided to go for a system that would be post-delivery of the benefit rather than pre-delivery of the benefit. They tried to establish some balance between pre and post, but I think we can draw a lesson right there on a national basis. When it comes to supply chains and goods, well, we examine the criteria which were used by government in developing what they needed. This is, in fact, a market, like for the masks, for example, where the demand outstripped the supply. Supply and demand, yes. Well, demand in any case. And we have to look at what the status is between supply and demand and the price of certain goods. such as masks and the surgical gloves, for example. The prices just skyrocketed. So this is why we have to take a look at that as well. So you're taking the same approach to the work. When the government is obliged to act and react quickly to protect the health system as a whole, or to support individual Canadians' salaries, income, you bear that in mind. I'm sorry, but timer just went off.
Question as
love
time
it, thank you.
constraints. If you would mind providing that to committee in writing, I would appreciate that. We'll now go to the third round, and we'll start with Mr. Paul Hoos.
Merci, Monsieur le Président.
Thank you, Chair. I'd like to come back, Ms. Hogan, on fraud cases that might have occurred and were detected. Well, we knew that there were some with the CERB, and there were some, of course, with the wage subsidies as well. Sure, there was an urgent need to respond quickly to provide the benefits, but also to minimize risks at the same time. We have to find the solutions, but we have to keep them reasonable. Now, on fraud. I know that the Department of Finance put into place some supplementary controls last fall. Do you think we'll be able to recover any monies that were frauded from the government? Well, I'm always of concern to make sure. The whole point behind the Auditor General's reports is to ensure that the government money is being spent wisely and correctly as well, be it for a wage benefit or a wage subsidy. And these post-event controls or verifications will have to serve. We have to ensure that there's enough capacity to conduct a thorough post-analysis, but they had to launch these programs quickly. Okay, so I'm sure you're going to take a look at the involvement of organized crime in your further analyses. It'll have to be followed closely. They would be involved anyway. Now, as to the business wage subsidies, it's known that many employers did not fraud anybody of anything, but they did take advantage. They did exploit the system. They stalled for months. They postponed signing any contracts or collective agreements, and they've made millions and millions of dollars of profits. Some of these businesses and major corporations said they had their best returns in years during the pandemic. Now, not necessarily illegal, but perhaps marginally in the gray zone. Is there anything to look at there? The development of the program did not discriminate on the size of the enterprise or the business. This was to encourage the maintenance of the employer-employee relationship. So the examples that you're sharing with us now will be looked at, of course, when we do our analysis. We're going to follow up on our audit on this issue in particular. You also mentioned the 3 reports, but report number 8, PHAC, they responded to the recommendation that, yes, we'll take care of it, we accept your recommendations, but it's often the case when we get a government report, we end up with situations that people were not ready, they didn't know what was going on 100%. Based on the discussions you've had with these various agencies and departments, do you think that people are made aware now that they have to act? What kind of changes do you think should be brought by the federal government itself? They have to recognize and acknowledge the shortfalls and get on with correcting them. All I can say, I certainly hope so, yes. I articulated a message quite clearly to the government. One of these messages It's time that the federal government address these long-term issues. I don't want to come back every year and repeat the same shortfalls, the same observations, the same flaws. I think that everyone will use this pandemic experience to improve how we do business if ever we get back to normal times. Would you say, as I would, that it's not necessarily a matter of money, but of human capacity and human will to do better? All I can say is that during the pandemic, there was no lack of goodwill to serve Canadians and to ensure their safety and security. However, there's just not enough hours in the day to do it, and in my office as well as anywhere else. So it's not a lack of goodwill or a good intention.
Go to Mr. Weiler for 5 minutes.
Thank you, Mr. Chair. And I'd also like to thank the witnesses, Ms. Hogan, Ms. Richard, Ms. Schwartz, and Ms. McCullough for joining our committee today, and for the excellent reports and recommendations you provided on the response to the pandemic from January to June of last year. There's been a lot of discussion already today about the CERB and about the potential abuse with the CERB. And Ms. Hogan, you mentioned a couple of the controls, the ESDC and CRA non-doubling and the student benefit and CERB non-doubling controls. The attestation form not also count as a control to be considered as part of this as well?
I think a personal attestation really isn't much of a control. I think there's always a personal attestation. If you look even at a normal program where there's lots of checks and balances to vet eligibility, an individual has to make an attestation. What was missing was asking for the documentation and the proof, right? And that's where I referred to earlier about sort of that international best practice in times of an emergency is you don't expect individuals to do all of that, but you expect them to have it all available. So when you come in post payment to verify eligibility, that they'll have all that documentation and information able to demonstrate and prove their eligibility versus just making a personal attestation at the beginning.
Absolutely. Well, thank you for that. And what other controls would you consider that the government might have looked at? And again, considering the context here of wanting to get this money out very quickly to make sure that that people have the opportunity to put food on the table and keep a roof over their head.
Are you referring again to the Canada Emergency Response Benefit?
I am.
So I think there really the program was meant to be rather quick, and so at least being able to see better information sharing between the Canada Revenue Agency and ESDC, I do think that that control that was kicked in a few weeks later possibly could have been done earlier, but I understand the issues that they felt that changing their IT system would have delayed it, and really that's where that judgment call was made to prioritize getting payments out to individuals in a timely way. So it really was a policy decision about that was the priority. And then the departments designed the program and the way they administered around that policy decision. So I think now we should focus in on the post-payment controls and seeing how that work might be done.
Certainly, and hopefully if we're ever in a similar situation like this in the future, we have the digital infrastructure, so we don't have to worry about the system collapsing in on itself with 50-year-old EI systems that are in place. You also provided some suggestions with respect to the wage subsidy as well, and you mentioned that the CRA should look at strengthening the integrity of it by using business intelligence information to conduct some targeted audits. I was hoping you could explain what you're recommending there in a little more detail.
Oh, absolutely. I will ask probably Philippe Lecoff to add in since he was responsible for the detailed work. But it's just in general what I could offer up is that they have a lot of business intelligence information at Canada Revenue Agency that they can use in so many ways. And we felt that there were some opportunities that they could have used that to target audits for suspicious activity that they might have seen or applications that alerted them. And they chose to just look at post-payment controls. So I don't know, Philippe, if you wanted to add something a little more specific, perhaps.
Yes, Mr. Chair, we recommended during the audit to the CRE to launch targeted audits based on the information that they got from business intelligence. Even though they could have not stopped the payments, they could have sent their people after the businesses that were submitting information that was suspicious. And the CRA did very little of that. And in our opinion, that would have helped to target those who were really at risk of misusing the program.
Thank you.
Thank you.
And one of the measures announced in the budget of last week was the creation of a new Canada Recovery hiring program that will be based somewhat similarly on a lot of the criteria of the wage subsidy. I was wondering if you'd have any suggestions here on integrity for the wage subsidy that you might also recommend for such a program.
That's a really tough question to answer when you don't really know the nuances of how that program might be designed and laid out. And I think any program that is targeting an emergency response likely has a different lens that you look at than a program that will be there for the long run, right? Most programs need to have really good upfront eligibility checks because that's your best line of defense, right? To make sure that you try to limit giving out payments inappropriately. So it's almost like comparing apples and oranges, but I think we'll do our best to monitor what's going on, and if we are asked any questions, we can provide some advice on what we saw as some of the potential pitfalls during the emergency.
Thank you, Ms. Hogan. We'll now go to Ms. Vignola for 2.5 minutes.
Merci beaucoup.
Thank you. Ms. Hogan, the budget announced that the wage subsidy will come to term in September, perhaps November, but there are some sectors, culture, arts, tourism, which were deeply affected. And in my writing, they're saying, no, we really should carry on with this until at least, to the end of the year, at least 2022. Now, are the resources there, regionally, locally, whatever, to relaunch the economy and respect your recommendations? When we examined the wage subsidy, we didn't really concentrate on that aspect. It was developed, this benefit, the subsidy, was addressed to address the greatest number possible of enterprises without really concentrating on the sector or the nature of them or the size of the enterprise. We wanted to cover as many employees as possible. So I suppose if we were to try to examine a number of alternate scenarios for the design of a program, we might wonder as to the silence on the analysis at the design stage. We know nothing about that. So I really can't give you an enlightened response. Well, thank you. In responding to this pandemic, I don't know if this will be or might be part of your next study, we've learned that $9 billion approximately were spent for vaccinations. If you have the details, okay, whatever you can share, but in a general way, as an Auditor General, were you able to actually see these contracts for supply of vaccines? Or were you constrained in seeing these contracts? Well, when I appeared before Public Accounts, in preparation for that, we did receive some of the agreements on the vaccines. The expenses related to those will, in fact, eventually be proposed to the Public Accounts Committee. But we don't think that there's going to be any particular issues in accessing the information on the purchase of these, and these will be examined later on.
Mr. Green for 2.5 minutes.
Thank you. So, in testimony, we heard that there were information and that CRA had at its disposal tools to be able to monitor the reasonableness of applications as it relates to the wage subsidies. And yet, you just received a order paper question where I asked about the CRA's decision to temporarily suspend, as of March 2020, the programs and services for high-risk audits, including international large businesses, high net worth compliance, GST of large businesses, and so on. In other committees, you've heard me, I think Ms. Hogan referenced the $120 million of subsidies that Imperial Oil took and the 300 and plus million dollars they paid out in dividends. So I've tried to find rationale on that, and I've had some challenges. So my question through the chair is, in ESDC's policy development and program design, is it your opinion that they adequately had analysis around the inevitability of companies taking wage subsidies and paying it out in dividends?
I just want to confirm that I have the question correct, because you referenced Employment and Social Development Canada, but they were not involved in the wage subsidy program. They were involved in CERB.
Well, Finance Canada was supposed to provide the analysis. And so if you'd like to refer to them, I would be happy to receive an answer if you think that they were adequate in analyzing the inevitability of the risk assessment that companies would take in wage subsidies and then pay out dividends.
So what we saw during the analysis by the Department of Finance for the Canada wage subsidy, what I can tell you is that we felt that the analysis was comprehensive and robust. Unfortunately, I can't talk about the contents of what was in that analysis because it was either contained in secret documents or cabinet confidence documents. So it wasn't that I did not have access to them.
What's
it's
the
just that I'm
difference
not
between
able
the
to
two?
report to them.
Well, and in your opinion, what's the difference between their secret documents and cabinet confidence?
So cabinet confidences are documents that go to the cabinet, typically contain recommendations and inform policy choices that or debates that the cabinet has in policy choices. And so that's really a matter of sort of
And secret
historical
documents, what would they
protocol,
be?
right? That keeps them secret. Secret documents are those where the author deems that the contents of the report might harm national security or an organization, and the author declares it secret. So you can declare it protected A, protected B, or secret. That's in line with the government security policy. And so items that are of a secret nature are not allowed to be disclosed in public documents. I must respect the security classification that the author puts on a document, and hence I'm not allowed to discuss the
That is
content.
very helpful.
Thank you very much.
I do
Thank you.
appreciate that. Thank you.
We'll now go we're going to Ms. Harder for 5 minutes.
Thank you, Chair. Last month, on March 22nd, at this committee, I asked Ms. Cindy Evans, who of course is the Acting Vice President for Emergency Management Branch at the Public Health Agency of Canada. I asked her if Canada's pandemic warning system had been fully operational. Would the government have heightened the threat level of the pandemic at an earlier date? And if therefore, increased safety measures such as closing the border. She responded by saying, quote, the number of alerts did decrease over the past number of years. However, GFIN continued to operate without reductions in that time. She continued to say, quote, the GFIN system did exactly what it needed to do, and the issuance of an alert to international partners would have in no way impacted the domestic activity that took place. Again, she repeated, quote, the GFIN system did exactly as it needed to do, providing the signal that was detected by the usual cases of pneumonia in Wuhan, China. I guess my question for you, Ms. Hogan, is in your findings, you state that PHAC's Global Public Health Intelligence Network, the PFIN, of course, did not issue an alert to provide early warning about the virus that would become known as the cause of COVID-19 just a little while later. Instead, the network shared daily reports only, as we've discussed, with Canadian subscribers, including federal, provincial, and territorial public health officials. But PHAC prepared 5 rapid risk assessments of the virus outbreak, but did not prepare a forward-looking assessment. You've talked about all of that. I guess my question is, based on your edit and your findings, if the system had been fully functional, if it had been fully operational, can you tell us how things may have transpired differently? And I recognize that an earlier statement that you made to a colleague of mine who asked a question was that you couldn't speculate. But I would propose, I suppose, that part of the audit that you've done as in your capacity as Auditor General is actually to say, these are the things that weren't done well, and perhaps these are the differences that could have been made in the lives of Canadians had they been done well. So I guess my question is, if we were fully operational, what would the difference have been?
So I can offer up a few things. I guess I would say that the Public Health Agency of Canada has criteria that would have called for an alert to be issued in this instance. There were alerts issued in the past. There was an alert issued for H1N1 and for SARS. It's not clear why an alert was not issued this time. You correctly identified that there was a significant decrease in the number of alerts issued, but I will note that throughout the pandemic, 2 alerts were issued, one for, I think, a tick bite virus coming from a tick bite out of China. So there was clearly alerts still being issued. The alert is not just for domestic, but also to alert our international counterparts. And I think this is where I don't think anyone could speculate what might have been different if our international counterparts had received the alert from GFIN earlier on. Would their response have been different? Would then our response or the spread of the virus be different? Those are all speculative. I don't think anyone could really say for certain, which is why I think it's important that the Public Health Agency decide what it expects from the Global Public Health Intelligence Network, make it very clear when and how it should be used, and then use it as intended. Because in our view, it was not used as intended, and I just alluded to all the reasons why.
So when Miss Cindy Evans, then when she says that the system did exactly as it needed to do, would you agree with that statement?
I would agree that the system issued a daily report, that the Chief Public Health Officer of Canada reacted to that report and alerted her provincial counterparts. But the system did not issue an alert, which, if for all intents and purposes, looking at the criteria and the past, should have been done. I guess I would equate an alert to like your smoke detector, right? When you're in your home, you want your smoke detector to go off to tell you, hey, stop, come and take a look, investigate what's going on and see if you need to react. If you're standing outside your home and it's already on fire, I don't think you really care if your smoke detector is going off. So I guess I would use it that way, right? An alert is meant to signal that you should stop and investigate and do something.
So sorry, so you just said that Ms. Tams did alert the provinces and territories in time?
The following, as I mentioned earlier, following December 30th daily report that contained an article about a virus that would become known as the one causing COVID-19, she did reach out to her provincial counterparts. If you take a look at that exhibit in, I think it's 8.1 in our pandemic preparedness report, you'll see a listing of some of the key dates, and that's listed in there as a key event.
Thank you, Ms. Hardy. We'll now go to Mr. Drouin for 5 minutes.
Merci beaucoup, Monsieur le Président.
Thank you, Chair, and I'd like to thank the witnesses who are with us today, particularly Ms. Hogan. Welcome to you and your team. The nice part about working for the Auditor General, you don't have to worry about the 30th of April. So I've talked to a lot of accountants recently, and I tell you they're under the gun. Now, more seriously, the work that you do is very, very important as an objective third party to correct some of the errors that may have occurred. I'd like to talk about the CBSA controls. You made recommendations. The department reacted. Ministerial decrees were put out by the department because certain things were changing pretty fast. I recall that, well, a year ago, April, there was a whole issue of temporary workers. And we really had to change and scramble to adjust the regulations so that our officers at the border could apply the law. Now, the department responded, but also pointed out that there has to be some time allotted to training the personnel. Now, sometimes you get an official decree by a minister, for example. You have to get into the shoes of those people who have to do the job. Is it possible to train them quickly enough in such a short amount of time when there's so many changes? You're quite right that there were an enormous amount of changes to the regs for the border agents. CBSA has could have cooperated a little bit more closely with PHAC. But as they were adjusting, the situation was changing as well. So not only the best possible available training for these individuals, but also to the structures. Follow up. Now, trying to ensure more consistency might have been appropriate. It's easy. It's easy to say that there should have been more training, but it's obviously more difficult to do it while a pandemic is unfolding, along with supervision, along with more controls, etc. So this is why we developed the recommendations that we proposed. Okay. Now, during your audit period, that was the 25th of March to the end of June, I believe. So during this period, a great majority of Canadians throughout the country, most of my colleagues were trying to get Canadians back home from points abroad. You spoke of follow-up on respect for quarantine or not. Should there be greater cooperation between public health authorities and our provincial counterparts? Mr. Paulus mentioned it earlier. In Ontario, it's the OPP. In Quebec, it's the SQ. In other provinces, it might be the RCMP. How do you see this unfolding? How would you frame a recommendation, and how would you document it? I don't see that we'd be hiring another 3,000 public health officers or agents. So how could we improve the situation without going overboard? Well, the recommendation here was based on being better prepared. And in order to be better prepared, it doesn't mean necessarily that you have to hire another 3,000 souls to ensure that people are respecting quarantine. Now, the idea is to have a plan in place to see if we have to increase capacities to enforce. I don't think that the agency was prepared to manage a pan-Canadian quarantine regulation and quarantine. Now, they had to find a way of following up. They started by using the telephone for the most part. When they determined that certain travelers were at high risk and were not going to comply, well, then they referred to police enforcement. So it's important to be better prepared, to have a plan in hand in case, to be able to crank up the capacity for surge capacity. And then, of course, it will diminish after a while, so we can't hire these permanently.
To our fourth round, and starting with Mr. McCauley for 5 minutes.
Thanks, Mr. Chair. Ms. Hogan, in your conversation with Mr. Green, we were talking about finance and doing an analysis regarding the wage subsidy. Do you know if the government acted upon the analysis and recommendations made by finance?
So as I mentioned earlier during the exchange with the other member, recommendations to the cabinet are in cabinet confidence documents.
No, I recognize that, but you mentioned, they did an analysis regarding, because I think Mr. Green was referring to payouts for dividends, et cetera. So companies receiving subsidies but still paying out dividends. you mentioned finance did an analysis to come up with the wage subsidy. Did our recommendations for it, did ESDC follow such recommendations, are you aware? Or did they just create it kind of out of the blue without any the feedback from finance?
So the Department of Finance provided advice on the design of the program and the advice that
Did they follow
informed
that
the
advice?
policy.
Yeah.
Well,
Did they
advice
follow?
that informed the policy decision. Once the policy was in place, then Canada Revenue Agency rolled out the program in accordance with the policy.
Okay. I just want to follow up. You mentioned again regarding this use. You mentioned the government followed best practices from around the world on the wage subsidy. I'm wondering what best practices, and what I'm getting at is, I was looking at the top 50 companies by market cap in Canada. About 10 of them who market cap is $1/3 trillion received wage subsidies. Now, these companies representing $1/3 trillion in market cap had $32 billion in profit. So again, I'm trying to get to what analysis from finance or what best practices led to the development of a program that would pay wage subsidies to a group. Actually, I think it was 7 of them were worth $1/3 trillion, but also getting to Mr. Green's point about a subsidy that would go to companies that end up paying dividends.
The best practices that I was referencing are best practices that are recognized internationally in an emergency situation. And those best practices are the ones that take all of those prepayment controls and focus on post payment.
Okay.
So the decision to do it personal attestations and move to post payment work.
So the best practice was about the delivering of the wage subsidy, not the makeup. Okay. I want to go to under your CERB report, 6.36. You state we found the benefit was being delivered. Finance performed an analysis to inform the Minister of Finance on proposed changes to the benefits in light of evolving crisis. Do you know if those proposed changes were made?
Your question is referencing to the Canada Emergency Response
Yep, the CERB,
benefit? Yeah. The changes that we saw happening throughout the program were the ones that allowed individuals to earn a level of income, $1,000.
So that's the one that came out of the
earlier.
finance analysis? Great. On to...
Well, they came out of finance and CRA and ESDC's analysis. There's a whole bunch of departments, right, who were doing analysis of the program.
Yeah. 6.38, you comment, we found that the CRA identified and suggested changes to ESDC on the design of the non-employment insurance emergency response benefit. Did they make those changes that CRA suggested, as you noted in 638? And what did CRA recommend that you've noted it in 6.38?
I think here I'm going to turn to Joanne Schwartz to perhaps provide a little more detail about that paragraph.
Sure, thank you for the question. In terms of paragraph 38, we did see that the CRA identified and suggested changes to ESDC on the design of the CERB. For example, additional mechanisms to recover funds.
Did they act upon them, though? Your commentary is not very clear on whether they actually made those changes.
So
as suggested by CRA.
So we don't report explicitly of whether those recommendations were in fact accepted. So in terms of additional mechanisms to recover funds,
can I ask why not? Like, what's the point of putting it in here when we're studying the CERB, whether it was rolled out effectively for the best for taxpayers? Like, and I'm sorry for sounding cynical, but what's the point of saying, well, CRA recommended stuff, and then not comment on whether the government took advantage of those recommendations from the experts or made such changes?
Mm-hmm. So our point of including it was to show that CRA was playing an active role and was involved in looking at how the design was happening for the CERB. So in the situation of additional mechanisms that they were recommended being included to recover funds, those were mechanisms that they saw that ESDC had, and they wanted to recommend it that they would also have them. To my understanding, not all of those recommendations were accepted.
Thank you.
Okay,
Thank you.
thanks.
We'll now go to Mr. Weiler for 5 minutes.
Thank you, Mr. Chair. When COVID-19 started appearing in Canada, we saw, and we've discussed today, how the federal government worked very quickly to protect Canadians and roll out a number of the programs that we've been talking about here. And the reports you put together, of course, focused specifically on the first wave of COVID-19 in Canada. And I understand that there's a lot of significant work that's been done to scale, particularly with PHAC's capacity since then. And we can see some of the responses from the government to the recommendations that you've mentioned here speak directly to that. But my question to you through the chair, Ms. Hogan, is do you agree that PHAC's response has evolved since the first wave?
Unfortunately, I'm not sure that I can absolutely comment on that. I think I see what you see in the media, but I haven't done any audit work to tell you whether or not PHAC's response has evolved. What we saw during the audit periods, and we demonstrated through the pandemic preparedness audit, is that they were adapting and evolving at those early stages. So I would assume that they would continue to adapt and evolve as the virus does, right? We saw them not have an agreement with provincial territorial partners, but even though that agreement wasn't there, it didn't stop them from discussing with them and making sure that they received the information they received. When they saw it was too much for provinces and territories to respond, they adjusted again to try and make it more manageable. So we definitely saw them reacting throughout the early stages, and I would just assume that they would continue to do so during.
Great, thank you for that. I understand you're doing audits on the next periods of the government's response to the pandemic, and assuming that's the case, when are you anticipating being able to release some of those findings?
I guess I would make two discussions here. We were planning on starting some other audits related to the pandemic that would have included the Public Health Agency of Canada and Employment and Social Development Canada, Canada Revenue Agency. They've asked us to delay some of them given the pressures on their people and the fact that we're in another wave now and we're still dealing and responding to the pandemic. And so we've agreed to delay some of the audits. We're going to replace them with other audit work. But in terms of pandemic work, as I mentioned in May, we'll have two reports, one on procuring personal protective equipment and medical devices, and one on support to Indigenous communities, including personal protective equipment and access to nurses and so on. And then there'll be some other pandemic reports in November, likely, which would include temporary foreign workers, protecting Canada's food supply. You can access all of our upcoming audits on our OAG website. There's a planned audit section, so you can see both COVID and non-COVID audits, as well as the Commissioner of the Environment and Sustainable Development audit work. They're all posted there for a couple of years now.
Great, thank you for that. One of the challenges that you've highlighted in your report is the jurisdictional breakdown of responding to COVID-19. And of course, as the provinces and territories are responsible for delivering healthcare, they're the ones that who make the decisions on public health measures such as stay-at-home orders and vaccine prioritization, among other things. How do you think the government can better work with provinces and territories to ensure we're responding to COVID-19 as kind of a Team Canada approach?
I think that's an excellent question, and one that I definitely encouraged, as I mentioned in my message to Parliament in March when I tabled my reports, that we need to study. Whether that means that an individual who can study the response countrywide is asked to do so, I think would be smart. As the Federal Auditor General, I can only look at federal responses, but as someone who could look across the country at what provinces and municipalities are also doing to respond, I think would help the country be better prepared for the next wave. What I can do is the vaccine audit, which is coming up at the end of 2022. I'm trying to coordinate with my provincial counterparts, so the auditors general in the provinces, to see if they can pick up the piece of vaccination where provinces take over the responsibility, and that my office can look at the vaccines from approval of vaccine all the way to delivery to the provinces, and then they can pick up the other half. So if we can coordinate our work, coordinate the timing of when we might publicly release our reports, that would help inform, I think, to Canadians in general how vaccines went from approval to shot in the arm. So that's something that I think I can do. But as a country, I do believe we need to figure out the best way to respond for the next health crisis.
Thank you.
Thank you.
Thank you, Mr. Weiler. And now we'll go to Ms. Vignola for 2.5 minutes.
Merci beaucoup.
Thank you very much. You noted that the CRA had conducted an agreement with the border agency to come to an agreement on the processes for immigrant travel control. Now, in terms of immigration, they were getting it on paper. Then it was to be digital. Then they couldn't find the electronic files, so they had to go back to paper copy. Now, are we going to fall into the same imbroglio shortly for other data formats? Will this jeopardize the safety and comfort of travelers? Will there be any other shortfalls? Well, I don't know if we can compare the two situations. The data required on travelers, when you have a quarantine of 40 days, if it's 40 days, so you get the paper documents. Now they have to be digitized. They could be digitized, but it took time and this caused some delays, 6 or 7 days. So if you have to assure a follow-up as quickly as possible to make sure that a traveler does respect the quarantine requirements, it has to be sped up quite a bit. So an app was developed. Initially, it wasn't being used. Then it became mandatory. But during our audit period, we noted that there was perhaps 1 in 5 travelers' files which was missing important and significant data in order to draw a judgment. So the agency had not planned ahead for this requirement. They'll fix it up for the next crisis, but we'll see if we have to declare another quarantine in future. Well, thank you. And if we were to compare with other countries, is our system on par, better, not quite as good, to be improved? I have absolutely no details as how other countries are ensuring a follow-up as to the respect of quarantine regs.
We'll now go to Mr. Green for 2.5 minutes.
Thank you. I'm still trying to figure out how the classifications of secret versus cabinet confidentiality. I'm not going to let it go. You're going to see me back at public accounts. I'll likely have another motion dealing with that this week sometime. And I'm just wondering, as an auditor, somebody who's reporting back to committees like this one in public accounts, are you confident that all measures were taken within the distinction between secret documents and cabinet confidentiality, that in fact they meet the smell test or the parameters that would allow that to happen? Because it feels an awful like everything coming out of this government in this pandemic when it comes to information, government that's supposed to be open by default, is either secret or it's cabinet confidentiality. So I'm wondering if you can help us unpack that a little bit.
I'm definitely not an expert, but I'll be sure to bring an expert when I go to the Public Accounts Committee tomorrow, because I'm sure you'll keep asking these questions. I guess what I can offer you up when it comes to cabinet confidence is it is really in constitutional history. Right, so that there's no discretion there, in my understanding. It's a question perhaps to the clerk of the Privy Council office for more information. But as soon as something's a cabinet confidence, that
I'm not as worried about that. What I'm concerned about is the way in which you've described that the authors are proactively, right, taking. We talked about proactive disclosures, and this time last year there was hundreds of proactive disclosures, and if I remember correctly, like throughout the last little while, there's been single digits or dramatically less proactive disclosures. So how do we get to a place where we have a government that's truly open by default when it seems like we can have authors of report just claim everything is secret?
Well, within any organization, in order to follow the government's security policy, there's some clear outlines on security classifications. And while the author is the one that sits back and looks at the information and determines its security classification, there is typically one of their supervisors or someone, a senior member of the management team that should challenge that and make sure that you do not overclassify a document. But as the auditor, what I can do is ask and question, are you sure this is the right classification? But in the end, I cannot change that. It is the author's discretion to classify. I then
Last
must
question,
follow
are
that.
you satisfied
Mr.
with
Green.
the
That's Mr. Green. I hate to interrupt you, but we want to stay on time constraints.
Do you though,
so...
Mr. Chair? Do you though? No, you're doing a great job.
Mr. Paul Hughes, 5 minutes. Oh, Mr. McCauley, 5 minutes.
Great. Thanks. I wish I could share my time with you, Mr. Green, because I enjoy where you're going. Just want to get back again to the wage subsidy, and the analysis. Somewhere in the report here, it said that Finance did a full and complete analysis that the department acted on, but it sounds like only an analysis of how to give out the subsidy and not whether it's targeted. Like the example I used, I was talking about some of the market capitalizations. Like, for example, Lululemon saw their market capitalization go up 15 billion last year, and yet we're still accessing the subsidy. Let me skip over that, please. If you page 13 of your report for the wage subsidy, 7.59, it talks about, or sorry, 7.61. Limited data to had the agency conducted business intelligence exercise in 2020. Agency analyzed data, etc. 35% of subsidy applicants, the GST HST collected in 2020 was 35% higher than the employer's gross revenue, as reported in their latest income tax return filed. Am I reading that right? That the people self-attesting to claim the wage subsidy were claiming a higher GST collected than they actually had in entire revenue the previous year?
I don't believe it was that they had higher revenue, but it was when you look at GST, you can infer what revenue would have been, and it made it appear that the revenue in 2020 was higher than 2021. What I think one is, so the first
it says
bullet
35% of applicants, the GST collected in 2020 was 35% higher than the employer's gross revenue, as reported. Not the employer's stated GST, but they're saying their GST was higher than the previous year's gross revenue. And also goes on, it says that the wage subsidies, there was a concern because it was self-attestation for the revenue drop. Am I, again, reading that correct?
I think the areas that you're highlighting are the areas that we mentioned earlier that we felt could have and should have prompted the agency to do some targeted work. So this was some of that suspicious information that came about that might have alerted. It doesn't mean something was wrong, but it might have alerted you that a better investigation was needed. But again, the decision was made.
I'm a bit concerned, and I'm not sure if you're just being nice here, but again, might have, could have. When we're talking about taxpayers' money, should the approach not be a bit more aggressive than, well, there might be some fraud, should look at it, or we could look at it, as opposed to the government definitely should take a look at this?
I guess I'm
and it might be just semantics, but I'm worried that throughout the report, it's nowhere does it say we should look after taxpayers' money. We should ensure the right people are getting the money. It's as opposed to, well, we could.
So I can't compel a department to change its approach. I just want to be clear that I'm always concerned when there's the potential that public funds have been misused. And that is my job. I worry about the prudent use of public funds. In this instance, yes, I believe that they should have used this information to do targeted audits. The Canada Revenue Agency made a decision not to, but to focus on post-payment work. So this was one of the instances that we alerted to them, and we put in our report that they should have used this information to include extra controls while the program was running. As we mentioned earlier, it doesn't mean they had to stop the payments, but this information indicates that there's a further investigation needed.
Right.
It doesn't indicate that there is a problem. And that's why I said the should or the might, because it doesn't mean there is a problem.
And
it just means they should go take a better look
yeah,
at
and
it.
I understand the need to get the program out running fast, which they did. But again, it's been I think April 11th is when they changed this use to the CEWS to 75%. Could they not have made some of these proposed changes in June, July? When I look at this 699, which is the paid leave for public service, CRA dropped from 36,000 people off work to 200 people off work in July. So according to CRA, all of their 45,000 workers, except for 200, were back at work. Could they not have made these changes in July to protect against such a risk?
Thank you, Mr. McCauley. That's a great question. And Ms. Hogan, if you can maybe provide an answer to the committee on that, it would be greatly appreciated. I'm just trying to respect your time, and I appreciate that if you would. We'll now go to Mr. Kazmierczuk for 5 minutes.
Thank you, Mr. Chair. The IMF in its March 2021 report concluded or stated that decisive actions and unprecedented fiscal support helped Canada to avert an even sharper fall in output. Ms. Hogan, would you say that the wage subsidy succeeded in getting support quickly to workers and to businesses?
What we found in our audit that the Canada Revenue Agency and the Department of Finance worked in very tight timelines to design and implement the wage subsidy, which was something that's never been done in Canada before.
So is that a yes? It did get that support quickly to workers?
Well, they rolled out the subsidy absolutely very quickly, and it's an indirect support to workers, right, through their employer. The objective was really to maintain that employer-employee relationship and to encourage businesses to stay open.
Gotcha. And I know in my previous questions regarding the wage subsidy, I know that you had mentioned that you really hadn't looked at, you know, in terms of the different types of analysis that could be conducted on the wage subsidy. You mentioned in the report that given the announced extension of the program, parliamentarians could benefit from knowing the economic effects of this program. You mentioned you really hadn't looked at the economic effects of this program, but in your opinion, what types of analyses could the department conduct on the economic effects of this program?
I guess just to be clear, we did look at all the analysis that the Department of Finance did leading up to the program. I can't discuss it in our report because of the types of documents it's contained in. That's why we made a recommendation that they should publish an analysis of the wage subsidy program to inform a good debate within Parliament, but also to make all Canadians aware of the things that were considered.
Okay, gotcha. I wanted to change gears a little bit and focus on the Canada Border Service Agency. Recommendation 8.100 states that the CBSA, in collaboration with PHAG, should ensure that border service officers have the appropriate guidance and tools to enforce border control measures imposed to limit the spread of the virus that causes COVID-19. Furthermore, because border control measures regarding entry and mandatory quarantine continue to evolve, CBSA should conduct a review of decisions related to essential workers to ensure that border service officers are properly applying exemptions. The findings from this review should be used to adjust existing and future guidance for the enforcement of emergency orders. How often, in your opinion, should CBSA conduct the review of its decisions related to essential workers during a pandemic?
It's a really tough question to answer. I think it depends how many times the orders are changing, and that judgment is always needed when you apply exemptions, and you want to make sure that the guidance is comprehensive and clear enough so that border service officers, when they each apply their own judgment lens to it, that they're trying to do so in the most fair and consistent manner. And that's why better supervision to make sure that those judgments were being applied consistently is what was needed. We also recommended that some additional control, but really relooking at any time a new order is issued, do you need to clarify the instructions that were given? So I think the frequency depends on how many times an order would change the guidance that you already have out there.
Would you say that the agency's process for evaluating and adjusting emergency orders and communicating those orders to the folks at the point of the border agent, are they sufficient? Did you have a chance to look at that?
I'm just watching a Carol who's nodding because I know we did look at whether or not they collaborated very well with Public Health Agency and that they together designed guidance in a good fashion. And so I think we did also see them by watching Carol's head nod, see them adjust as they needed it throughout the pandemic.
Okay. Thank you very much, Ms. Hogan. And Mr. Chair, that's all the questions that I have actually today.
Thank you, Mr. Kazmierczuk. And with that, I'd like to thank the Auditor General for her presentation today and thank Ms. Hogan, Ms. Richard, Ms. Schwartz, Ms. McCullough, and Mr. Legoff. And I apologize if I mispronounce any of your names. But I thank you for being here and providing us with some answers. And where possible, if you do have further additions to your answers that you've given, if you would forward that to the clerk, that would be greatly appreciated. The clerk will dispense that to the whole committee. So with that said, and we are right on time at 5:34 based on the clock I have here, exactly 2 hours, I declare the meeting adjourned. Good evening, everybody.